Jason McClellan, yeah, Colin, and Annabelle. Yeah, Diolch, Annabelle. Yes, we've got 3 more here this evening. Right, so to go back then, last autumn the council launched this thing called Cutting Our Cloth. At that point, and this is one of the reasons that Denbighshire Voice started, they said that the average cost per person per week in one of the care homes at Cysgod in Dolwen, that's Dolwen in Denbigh and Llais in Ruthin, was £800 per person per week. And I was not the only person to look at that figure and think, that doesn't look right to me. Since then, I've found out that that actually wasn't right, because in this new document that Meyer and Lowry have got over there, what they've said is that if Dolwen was running at full capacity, which it isn't, and it hasn't been for a while, because there's been a systematic campaign to turn people away, to try and keep the number of beds occupied low, it makes it look more expensive than it is. If it was fully occupied, the price of a person per week in Dolwen would be £476, as compared to a figure of £465 in the independent sector on average. If you break that all the way down, what we're really asking is, are our local elderly people in Dolwen worth an extra 6.5 pence per hour? That's what we're talking about here, if we knuckle it right down to the figure. And I think it's incredibly important that we all know that, because the figure that they quoted during the first bit last autumn certainly wasn't £476. And again, I took exception to that. Now, Denbighshire has concluded that standardised residential care is an outdated method of care for frail elderly people. I say that's flawed, because it's based on a survey that was conducted 5 years ago of people between the ages of 60 and 65. Let me ask, how many people are there in Dolwen between the ages of 60 and 65? Thank you. At the meeting of the council, full council, and I'm going to read this out, and I'm not going to make any apology because it outraged me then and it outraged me now. A lead officer of this council said, and this is the quote, "Campaigns and petitions received driven by specific groups don't always necessarily represent the views of the wider community, so it's important that people understand that." And I just felt that was an outrage to make that sort of a comment. I think everybody that's here tonight has got an absolute right to their say that they care and they want to be heard. And it's not for a lead officer to tell anybody that they can't have their voice in whatever forum. So last year they had this consultation, which was again a bit of a sham, because unless you were online you wouldn't have known about it, and even if you were you probably still wouldn't have done, which explains why only 822 responses came in from an eligible population of over 45,000 people that could have actually engaged with it. Doesn't look good, does it? So the aim of tonight's meeting, lest there be any doubt at all, is to let's keep Dolwen as it is. Let's not take it out of local authority control, and let's not shift the emphasis to EMH, elderly mental health. I acknowledge the fact, in my own profession, working in the hospital that I do, that the need for elderly mental health is getting bigger, but the argument doesn't follow that you get rid of a crown jewel to make way for it, because this is a completely different cohort of patients. These are patients that have a specific need that I've already referred to. So, in my job in the NHS, I hear a lot about bed blocking, but how do you think it feels for that person who's very often, you know, an elderly person, they're being branded as bed blocking, when actually it's because there's nowhere for them to actually go. And the moves that are being proposed here are actually going to make that situation even worse. And that to me seems totally silly, it doesn't make any sense. So there's also a moral case as well, which is caring for our own. You know, these are people that have given a lot to Denbigh and the surrounding areas, you know, the villages around. And it just seems right, they've paid their dues, they've put a lot into this society, that we look after them in their twilight years. And as I say, I've seen the evidence of this in my own family, so I'll be the first to stand up. So, Dolwen for me is best of both worlds. It's home from home, in a community where you're not going to be lonely, where you've got the love, you've got the care, and you're still part of the town. I don't want us to lose that. So in the end, what we're talking about tonight is, do we want care or do we want cost? I know which one I want. And if we're only talking about 6.5 pence per hour, I definitely know which one I want. So I'm going to finish now, and I'm going to hand over to my Rowlands and just say, please help us to keep Dolwen as it is. There's people on hand here ready to help tonight. Any questions afterwards? We're going to open it to the floor, so the majority of the speaking will be from you, not me. Thank you very much indeed.
Thank you very much, Alistair, and thank you very much for sharing your own experiences. My name's Mai Rowlands, and for those of you who don't know me, I'm the Assembly candidate for Plaid Cymru in the Vale of Plaid. Thank you all for making the effort to come here tonight. It's fantastic to see so many of you here supporting the campaign. I'm going to speak a bit in English and Welsh, so if you can all have your headsets ready. Diolch i chi am wneud yr ymdrech i ddod yma heno. Da ni werthfawrogi hynny'n fawr. Mi allwch chi fel pobl Ddinbych fod yn falch o'r traddodiad sydd genddoch chi fel tref dros blynyddoedd o falu am bobl. Mae'r gofal sydd i gael yn Dolwen yn sicr yn perthyn i'r traddodiad hwnnw. Mi fyddai'n gwneud rhai sylwadau yn Saesneg i ddechrau heno ac yna'n troi i'r Gymraeg. Denbigh and the surrounding area have a proud history of caring for people. The former psychiatric hospital in the town and the isolation hospital in Llangwyfan served the whole of North Wales. Dolwen belongs to that proud tradition of excellent care and commitment from those working in the health and social care sector. We know that there have been big changes in both sectors over the years, but closing Dolwen or putting it into the private sector is a backward step and a step too far. It would also break up a caring community at the very heart of the town. A caring community built on the hard work, dedication and commitment of the staff at Dolwen. What would happen also to the excellent respite care provided here? It would clearly be under threat. Dolwen also took in people who had lost their homes during the floods in St Asaph. That support would be under threat as well. Many people in this area have a good reason to thank Dolwen for the care that their friends and relatives have received. We in Plaid Cymru have arranged this meeting with Llais Ddinbych, Denbighshire Voice, to make sure that your voices can be heard loud and clear at County Hall in Ruthyn. We decided to hold the meeting now for a number of important reasons. The first is that we are at the beginning of the formal consultation period, like Alistair's already mentioned, and we need to get the campaign up and running and get more people involved before the consultation ends in January. The second is that we need to make very clear, right at the start of the consultation, that there is a strong opposition in the town and the surrounding area. It's very important that the campaign to save Dolwen starts to build momentum, and we would welcome any ideas that you have on how we can shape the campaign. And the third reason is that we need to continually engage with Denbighshire County Council officers and councillors to make sure that they understand the strength of feeling on this issue. And I'm very glad to see some of the councillors here tonight. We want as many people as possible to write to the council, to lobby our county councillors, and to attend the public meetings that the council will be organising locally. I know that Denbigh Town Council has discussed this issue and that your local councillors are keen to hear your views, and I would urge them to express their views here tonight also and during the consultation. Our Plaid Cymru group on Denbighshire County Council made a special appeal to the council's cabinet to make sure that this consultation involved the whole community, and they have agreed to this. The main driver for the changes, and the council also admits this, are the deep cuts to public spending introduced by both the Conservative government in London and the Labour government in Cardiff. Yes, there might be different ways of providing care for the elderly, and we need to look at them. But, and this is a very big but, their plans mainly seem to be about privatising the service and reducing costs. I have deep concerns about both of these aspects and uncertainties that they will bring. We as a party have consistently opposed the major spending cuts to our public services. I will now turn to Welsh. Mi rydyn ni ym Plaid Cymru wedi cydweithio efo Llais Ddinbych y drefnu'r cyfarfod yma heno. Ond mae rhaid i ni gynnwys pobl o bob plaid yn yr ymgyrch, a rhai ohonoch chi sydd ddim yn cefnogi unrhyw blaid arbennig. A'r hyn sy'n ein hunan i gyd ydy ein bod ni'n teimlo'n gryf bod angen diogelu'r gofal sy'n cael ei gynnig yng Nghartref Dolwen. Mae ganddyn ni brofiad ym Plaid Cymru o ymgyrchu'n llwyddiannus i ddiogelu cartrefi preswyl rhag cael eu cau. Mi roi un enghraifft i chi, efallai chi glywed yn ddiweddar am y frwydr debyg ar Ynys Môn i wrthwynebu cau cartrefi preswyl heilfre yn Llangoed Biwmaris. Roedd Cyngor Ynys Môn yn bygwth cau heilfre ar unwaith oherwydd diffyg gwariant ar gynnal a chadw gan y cyngor ei hun. Ein cynghorwyr lleol ni'n Plaid Cymru a'n aelod cynulliad i'r Rhina Piorwedd oedd yn arwain y frwydr yn erbyn y cau. Roedd nifer o gyfarfodydd cyhoeddus, tanllyd ac fe gawson nhw lawer o gyhoeddusrwydd. Beth bynnag mae'r frwydr newydd wedi cael ei ennill, ac mae Cyngor Ynys Môn o dan bwysau mawr gan bobl leol wedi ildio ac am wario 160 o filoedd ar welliannau heilfre. Mae hyn yn dangos bod modd i ymgyrchoedd yr fath lwyddo, a bod y modd newid meddyliau'r cynghorwyr sy'n gwneud penderfyniadau. Mae yna resymau cryf iawn dros wrthwynebu'r cynlluniau'r Cyngor Sir ar gyfer Dolwen. Mae'n hollol glir i mi o ddarllen y dogfennau bod swyddogion y Cyngor Sir eu hunain yn cydnabod y byddai cau Dolwen yn creu sefyllfa anodd iawn. Sefyllfa argyfyngus yn wir i'r preswylwyr yw teuluoedd ac i'r ardal gyfan. Mae'r Cyngor Sir hefyd yn derbyn bod safon y gofal yn eithriadol o dda yma, a hynny yn ôl tystiolaeth y preswylwyr a'i teuluoedd. Dyma chi rai o'r sylwadau ganddyn nhw, a dwi'n ei dyfynnu yn Saesneg. These are some of the comments by Dolwen residents and their families during the initial consultation. One of the residents says this: I have been in Dolwen for a few years and it has become my home. If I had to move away from Denbigh, my family will not be able to visit me very often. I'm feeling very upset about it. And then from some of the families we have the following comments. Firstly, this: I don't think there is a home in or near Denbigh that can take my aunt with the care she needs. To close Dolwen will be a big loss to the elderly. It's such a good home. And another comment: the distress caused by a move and unfamiliar environment for a person suffering with dementia can be catastrophic. The residents of Dolwen are extremely vulnerable and are unable to look after themselves. Also this comment: the quality of care received at Dolwen is second to none in the Denbigh area. The ability to speak Welsh is of great importance to many Dolwen residents, and this is their first language. And finally, one relative has summed it up very well. I am appalled that the council should even be thinking of closing Dolwen. I hope common sense will prevail. Da iawn wir, a dwi'n siŵr ei bod ni gyd yn cytuno efo'r sylw olaf yna. Mae'r sylwadau gan y swyddogion hefyd yn dangos bod y ffaith bod Dolwen yn gartref lle mae'r Gymraeg a'r Saesneg yn cael eu lle ochr yn ochr yn hynod o bwysig i'r preswylwyr. Yn wir, mae yna gymuned glos sy'n defnyddio Cymraeg yn bennaf o ran staff, preswylwyr, teuluoedd ac ymwelwyr. Un o'r dadleuon cryfaf yw y byddai chwalu cymuned o'r fath yn amddifadu rhai ar Gymraeg yn iaith gyntaf iddyn nhw, rhag cael y cyfle i'w siarad yn rheolaidd. Sefyllfa fyddai'n sicr yn torri eu calonnau. Byddai hyn hefyd yn tramgwyddo eu hawliau dynol, ffaith sy'n cynnig sail gref iawn i wrthwynebu. Dadl arall gref ydy byddai pobl yn gorfod cael eu gyrru allan o'r cymuned naturiol i gael gofal o hyn ymlaen. Byddai hynny'n ei gwneud yn anodd iddyn nhw gael ymwelwyr sy'n dibynnu ar drafnidiaeth cyhoeddus. Wrth herio'r cynlluniau yma, mae cyfle hefyd i ni awgrymu atebion eraill. Yn sicr, mae cyfle i ehangu'r cydweithio rhwng yr ysbyty dros y ffordd a'r cartref. Mae gwell cydweithio rhwng iechyd a gofal yn rhan o'r strategaeth newydd, beth bynnag. Ehangu'r ddarpariaeth yma sydd angen, nid ei dorri. Ac un nodyn personol i orffen. Roedd fy nhaid a fy nain yn byw ychydig rysau ffwrdd o Dolwen yma ar ffordd Rhythun am bron i 25 mlynedd. Mi roedden nhw'n nabod llawer o rhai oedd yn Dolwen ac yn ymwelwyr y cyson. Roedden nhw wedi dweud llawer gwaith mae i Dolwen yr oedden nhw am ddod petai'r rhaid iddyn nhw rhyw dro. Oni bai eu bod nhw wedi symud yn ôl i Sir Fôn ar ôl ymddeol, mae'n ddigon posib mae yma yn Dolwen y byddai nain heddiw. Mae hi'n 95 oed erbyn hyn ac yn bregus ei iechyd. Dwi yn gwybod sut mae'r rhai sydd yn Dolwen a'i teuluoedd yn teimlo ar hyn o bryd. Y pryder a'r ansicrwydd sy'n eich llethu a hynny dros gyfnod hir. Mae rydyn ni fel teulu wedi bod drwy brofiadau digon tebyg. Denbighshire needs elderly care provision that is publicly run and community focused. People are getting older and the demand for care for the elderly will only increase in the future. Ensuring that the elderly live independently is important, but extra care is not suitable for all, and some people need this service provided by a care home. That is why we're calling for the Council to keep Dolwen open. And finally, it's clear to all the care that the care provided in Dolwen is exceptional and a lifeline to the residents and their families. Yes, by all means, adapt and improve the service, but closure is not the best option, not by any means. And I'll do everything to help your campaign to oppose to such closure. Thank you very much, Stephen.
Thank you very much indeed, Niall. And I'm just quickly going to hand over to Mabon Gwynfor now, and then after that we'll go over to the floor, which is what tonight's really all about. Yeah, Mabon.
Nos ydw diolch yn fawr iawn, Alistair, diolch yn fawr iawn, Mair. Mae'n rhyfeddol gweld cynifer o bobl yma heno. Mi ydw i wedi bod yn rhan o'r ymgyrch yng Nghorwen, iachub cysgod y gair, nôl y mis Medi, mis Hydref dwytha wnaethon ni gychwyn. Pan o'n i wedi darllen y papur lleol, y Free Press, fod yna sôn fod nhw am newid gwasanaethau gofal yr henoed. Mi wnaethon ni gychwyn llythyr i'r papurau a chysylltu efo'n cynghorwyr a swyddogion yn syth bin lawr yng Nghorwen. Ac oddi ar hynny, da ni wedi bod yn rhedeg ymgyrch gre i gadw'r cartre yno. Ac ers hynny, wrth gwrs, gaethon ni gyfarfod cyhoeddus yng Nghorwen ôl yn mis Chwefror, Ffebruari? Ac yna dwi wedi bod yn y cyfarfod, trefn y cyfarfod hwnnw, ac yna yn y cyfarfod yna welon dros yr haf ac yna hwn. A mae'r cyfarfod yma'n dangos, fel y ddwy gyfarfod arall, fod y teimladau mor gryf o blaid yn cartrefi gofal ni yn ein cymunedau. Ac un peth arall hefyd gai ddweud, yr un peth dyn ni wedi gychwyn yng Nghorwen yn ddiweddar iawn, ac wrach fysa yn syniad i bobl yma heno, wrach newch chi drafod o maes y law heno, da ni newydd gychwyn crowdfunding, ymgyrch i ariannu'r ymgyrch ymhellach, ymgyrch ariannol. Mae pobl yn rhoi pres ar-lein lawr flaw yn y siop lleol mwyn bod ni'n cynhyrchu posteri ac yn y blaen i roi yn y ffenestri yn y gymuned. Dwi'n siŵr newch chi drafod lle ydych chi am gyda'r ymgyrch maes y law. Mae hwnna'n rhywbeth da ni'n neud yng Nghorwen a fyswn ni'n falch i gael cydweithio efo ymgyrchwyr yn Ddinbych ac hefyd yn Rhuthun. Ond o feddwl am cartrefi gofal, wrach bod yn werth meddwl yn ôl ychydig ar trafodaethau sydd wedi bod yn y sector gofal dros y blynyddoedd dwytha. Da ni gyd wedi clywed wrth gwrs am y sector gofal a newyddion drwg sydd wedi bod yn benodol yn ochrau Llundain ac Essex. Mi gofiwch i'r rhaglen Panorama flwyddyn yn ôl yn sôn am y problemau yn y sector gofal. Wel, cyferbyniwch hynny efo'r gofal rhagorol sy'n cael ei ddarparu yng Nghysgod y Gair, a Welon a Dolwen. Does na ddim cwynion gan y trigolion y preswylwyr na'i teuluodd. Maen nhw'n cael y gofal gorau posib yn eu cymuned. A dim ond fi sy'n dweud hyn yma heno. Mi ydyn ni'n yr ymgyrch yn Cysgod y Gair wedi derbyn cannoedd ar gannoedd o lythyrau. Dwi'n gwybod bod yr ymgyrch yn Welon wedi derbyn cannoedd o lythyrau. A mi ydych chi wedi cael pobl yn sgrifennu mewn ar ran Dolwen hefyd yn eu cannoedd yn cefnogi y cartrefi yma. Felly nid pobl sydd ar ben lwyfan sy'n dweud hyn. Ac hefyd mae pobl yn meddwl mae henoed yn unig sy'n pryderu am yn cartrefi gofal. Wel, edrychwch eich amgylch yma heno. Dwylo fyny pawb sydd yma o dan 65, os gwelwch yn dda. Yn heliw ohonoch chi. Yn heliw, rhan helaetha ohonoch chi yma'n bresennol o dan yr oedran o pobl yn ystod sydd angen y gofal yna. Yn dangos, mae nid hyd anoldeb ydy hyn, yn acydd. Concern, pryder am aelodau teulu ni, am yn cymdogion ni, am yn cymuned. Dyna beth sy'n cael ei ddangos yma heno. Felly beth yw'r angen am gartre gofal? Let's start with the need for the care home. According to research and statistics given to me by the National Assembly's Research Department, 2% of the total population of people who are 65 years of age or over in Wales were cared for in care homes here in Wales. 2%. It doesn't sound much, does it? And at the end of the day, sadly, this is what we're talking about, figures and statistics. But if you look at the population estimates of the ONS, the Office of National Statistics, in mid-2012, there were 1,792 people over 65 years of age living in Denbigh, the 3 wards in Denbigh. Denbigh Central, what have we got? Denbigh Lower and Upper with Henllan, yeah? So 1,792 people over the age of 65. Now, if you take the statistics provided by the National Assembly as correct, that means that there's a need for something like 36 people in this community, immediately in this community. We're not talking about Cymru, Ddinbych and other nearby wards. Just in the town, there's a need for a care home for some 36 people. So that's Dolwen for you, really, isn't it? Hey presto, we have the need, we have the home, we have the service. So it's clear that this area, this town, this community requires a care home of this size. What's more, the number of over 65s have increased over the last couple of years as well. Those figures relate back to 2012, don't forget. And we also expect to see the number of people over 65 increasing by a factor of 50% over the next 17 years. Tie this in with the fact that Cymru and Denbighshire have the highest proportion of people over the age of 65. In Denbighshire alone, we've got somewhere between 18.5% and 20% of the population who are over 65 years old. There is clearly a need for a care home. Now, yes, when we talk about care homes, well, there is a need. Let's not forget, there's a need for an EMH. Yeah? We need an EM item. We need a home. Is it EMI these days or EMH? Yeah. We need a home for EMH people. Yeah? So we need care in the home as well. But there's always going to be a need for the care home. So, if they close it, if we know that there's a need, where are the people going to go? Not just the residents there currently, but other people who will require this service in the future. I would say that the council is duty-bound to provide that service. And not only provide it, but provide it in a similar environment. So what's the environment? First and foremost, those residents that are in Dolwen, Llais and Ddinbych, they come from the immediate community. Will those residents and future residents be placed in their immediate communities? No, they won't. Correct. Because sadly, the care homes that we have in these communities are either full or they don't cater for these needs. And we've also heard of a nearby care home closing as well, which is privately run. Because of the squeeze on care homes, because of the fact that local authorities aren't actually paying the amount necessary to private homes to run their homes. So what are the alternatives? Care in the home? Well, care in the home is a fantastic alternative. It is a very good service, and some people do excellent work with care in the home, independent living. And it is appropriate for a great many people, but not for all, as we've just heard. If you consider Ddinbych, Llais, and I'm sure Dolwen, and I'm talking from my Ddinbych experience, but there's a lot of similarities in these care homes. We know that, for instance, in a publicly run care homes, like ours here in Denbighshire, they are centred around the people who live there. They are based in the community. And it's 24-hour care. And if people in the care homes need medication, you've got the staff who go and remind the people there. Remember to take the medication. Remember to drink enough fluid. Do you get that in a care at the home environment? Sadly, no. So some people do require those services that are provided in a care home setting. These are personal, caring, loving environments because it's a community service. Because the people there working in our care homes, they know the people who live there. Many of them have known them from a very young age. They've grown up with them, seen them throughout their lives, only for them to then move on to the care home and work with some of the elderly residents. These people we're talking about, they're not paychecks. They're not statistics at the bottom of a spreadsheet. These are people who have lived fulfilling lives and contributed to our society. But more than that, when you look at the proposals in Denbighshire and across Wales and the UK, I'm concerned that authorities, local authorities, Denbighshire in this case, were pushing people and the elderly care sector more and more down the route of what is called independent living, forcing people to live in their own homes. Now, as I said earlier, a lot of people do want to live in their own homes, and undoubtedly it's a better environment more often than not, but there's always the case when it's not. We're told that independent living is better for older people, but I question, is it? Is it always better? What do you think is the biggest challenge facing the elderly in our society?
Loneliness.
Loneliness. Exactly that. There's research carried out. The Society of St Vincent de Paul published this statement, and I'll read only a small part of it. Loneliness, and this was back in 2011. Loneliness is the biggest individual problem faced by older people living alone, according to new report, Older People, Experiences and Issues. It is particularly acute in rural areas with a reduced level of human contact as a result of declining public services, such as the closure of post offices and reductions in other local services, including transport. There's a lot of this that rings bells and rings true with us, doesn't it? A particular problem highlighted in the study was the lack of transport services to hospitals and other medical appointments. The researchers heard numerous examples of older people obliged to make long, difficult and sometimes stressful journeys to hospitals at great personal expense. Poor public transport was identified as a significant problem in built-up urban areas as well as rural areas. There's a lot of that true about Denbigh and Rhythin and Corwen, isn't there? I don't know if our senior officers in the local authorities in Denbighshire have had to travel on buses recently. I suspect not. But they've also cut some of the bus services, incidentally. Isn't it going to be very, very difficult for especially elderly relatives to visit their loved ones? If people in Dolwen are having to go down to Cysgyragair, how are family members from here meant to travel down there? And vice versa. How are we over down in Corwen meant to come up and travel and visit residents and relatives up here? The buses aren't there anymore, sadly. And there's a fantastic group of people called the Campaign to End Loneliness. Loneliness and social isolation in the United Kingdom. 17% of older people are in contact with family, friends and neighbours less than once a week, and 11% are in contact less than once a month. More than 1 in 10 of our elderly people, members of our own society, are in contact with their friends and families only once a month. Over half of all people aged 75 and over live alone. 63% of adults aged 52 or over who've been widowed, and 51% of the same group who are separated or divorced report feeling lonely sometime or regularly. 59% of adults aged over 52 who report poor health say they feel lonely some of the time or often. And 2/5, get this, 2/5 of older people say that the television is their main companion. Loneliness, it says, is a bigger problem than simply an emotional experience. Research shows that loneliness and social isolation are harmful to our health. Lacking social connections is a comparable risk factor for early death as smoking 15 cigarettes a day, and is worse for us than well-known risk factors such as obesity and physical inactivity. So our residents, our loved ones in our care homes, they get to meet each other, talk to each other. They get company 24 hours a day if need be. In a care at home environment, does that happen? No, it doesn't. So I ask again, is there a need for Dolwen? Yes, we can prove that. We know that the need is there. And also, if we're thinking about the residents and the need for the residents, let's think about the need for the relatives and the loved ones and how they are going to see and visit, as I mentioned earlier. Felly, I orffen, mae rhaid i'r rhai hynny sy'n cynnal yr arolwg yma gofio drwy gydol yr holl waith maen nhw'n gwneud I bod nhw'n trin ac yn trafod pobl o gig a gwaed. Pobl sydd yn perthyn I ni. Pobl ydyn ni yn ei adnabod. Pobl ydyn ni yn ei caru ac yn ei gwerthfawrogi. Un o'r argymhellion I bob pwrpas yw I ddadlwytho gofal henoed I gorff allanol, oherwydd I bod nhw'n fwrn ariannol. Ond gadewch ni fod yn onest, nid arian yw pobl yma ci. Mae rhaid I ni ddangos bod fwy o werth i'n pobl ni. Fod yna werth y tu hwnt I arian. Mae rhaid I ddangos fod yna werth pobl, gwerth mewn bywyd, gwerth yr hyn maen nhw wedi chwarae yn rôl yn cymdeithas ni. Dyna bwysigrwydd gofal da ni'n darparu ar gyfer yn henoed. A gadewch ni wneud yn siŵr efo'n gilydd, Dolwen, a Welon a Chysgwr y Gair yn bod ni'n dangos yn bod ni fel cymdeithas yn gwerthfawrogi'n henoed ac mae'n nid just ffigurau ar ddiwedd spreadsheet ydyn nhw. Diolch yn fawr chi.